Eating disorders. What is eating disorder? It is a mental health condition characterized by unhealthy eating behavior. In eating disorder, people will try to show different type of control measures of food eating pattern to cope up with their feelings and emotions. Causes: mental health problems, body image factors. Mental health problems include anxiety, depression, low self-esteem, childhood traumas, abuse, social stress, peer pressure, and bullying. Body image factors include weight testing, comments from others, fixation with body thinning, social media problems, influences of celebrities, childhood feeding pattern, gastrointestinal problems, and body dissatisfactions. Two things can see in eating disorders: eating too much and eating less or nothing. The most affecting age is 14 to 17 years old, and the happy news is it is treatable. Types of eating disorders: anorexia nervosa, bulimia nervosa, binge eating disorders, and other specified eating disorders. Anorexia nervosa means not eating enough food, exercising too much, or doing both for controlling the weight. Bulimia means eating too much and losing control over the eating pattern, then taking serious method and actions to not put on weight. Binge eating disorder: regularly eating large portion of food until you feel uncomfortably full and at last you feel ashamed or guilty. Anorexia symptoms: losing a lot of weight and avoid eating food, lying about what you have eaten, taking medicines like appetite suppressants, diet pills, exercising excessively, fear of gaining weight, and strict rituals while eating. Other symptoms include low body mass index, constipation and stomach pain, headache and dizziness, loss of hair, dry scalp, depression or mania. Warning signs of anorexia nervosa: dramatic or very severe weight loss, lying about weight, avoid social eating, cutting their food into small pieces, trying to hide how thin they are and wearing loose clothes. In children, growth spurts may be delayed. Bulimia nervosa symptoms: eating a large amount of food over a very short time, fear of gaining weight, or being very cautious about your weight, mood changes and thinking about food, feeling ashamed, avoiding parties, feeling tired, bloating or tummy pain and puffy face, and at last self-harming. Warning signs of bulimia: eating a lot of food, eating very fast, going to the bathroom a lot after eating, excessively exercising. Binge eating symptoms: eating when not hungry, eating very fast, eating alone, and feeling depressed. Warning signs: eat a lot of food, try to hide what they are eating, store up supplies of food, put on weight, but put on weight does not happen in everyone with binge eating. Most common eating disorder is other specified feeding or eating disorders, that is OSFED. Symptoms can see from any three specific eating disorders, that is anorexia nervosa, bulimia nervosa, or binge eating disorders. This is the very common type of eating disorder. People suffering from other specified feeding or eating disorders definitely needed treatment like any other eating disorder. Some examples of OSFED are atypical anorexia, bulimia nervosa, purging disorder, night eating syndrome. Atypical anorexia means all anorexia symptoms can see except their weight remains within a normal range. Bulimia nervosa means all of the symptoms of bulimia except the binge eating. Purging disorder means being sick or using laxatives. Night eating syndrome means repeatedly eats at night. Signs include secretive behavior around food while eating, too much self-conscious, low confidence, low self-esteem, poor body image, mood swings, tiredness, social withdrawal, and difficulty in concentrating. Next type of eating disorder is avoidant or restrictive food intake disorder. It is characterized by avoid certain food and specific limit in eating or does both. The reasons are negative feeling of smell, taste, or texture of certain food, past experience with food that was upsetting, like choking or being sick after eating something, not feeling hungry, just a lack of interest in eating. Symptoms of eating disorders which others can observe are worrying about weight and body shape, avoiding socializing, exercising too much and taking pills, having very strict eating habits, and changes in your mood like anxious or depressed. Treatment. Treatment involves a combination of talking therapy and supervised weight gain practices. Treatment for anorexia is slightly different for adults and children. Talking therapy. Under that, cognitive behavioral therapy or CBT. The duration of CBT is 9 to 10 weeks. CBT taking place by talking to the therapist and will develop a personalized treatment plan. The end result of CBT is cope up with feelings, change the maladaptive behavior to adaptive behavior, understand the importance of food and consequences of starvation, and practice healthy food choices. Medically anorexia nervosa treatment for adults or mantra. Mantra is a type of talking therapy which gives freedom to talk to a therapist to understand what's causing your eating disorder. Family can participate in this mantra therapy. 20 sessions will be there normally. The first 10 should be weekly and the next scheduled based on the convenience of the patient. Other treatments include diet advice, depend upon the condition of the patient, family therapy. Family therapy means taking family to the therapy, family talking to a therapist, exploring how anorexia has affected and how family can support to get out from the problem. Adolescent focused psychotherapy. It includes 40 sessions and the end result will help the patient to cope up with anxiety and fears. It helps to understand what we need to do to be healthy and energetic and also what is the actual reason and at last helps to understand how to stop it. Medical management include antidepressants, example fluoxetine. Antidepressants will give in combination with talk therapy. Antidepressants are very rarely prescribed for children under the age of 18. For eating disorders, treatments can start without hospitalization. But if the situation is critical, hospitalization is a necessary thing. Other treatment include self-help program with the help of the therapist. It includes monitor what we are eating, plan simple meal plans, understand and study about the triggers which stop us to take food, identify the causes of eating disorder and find other ways of coping. This is about eating disorder. So eating disorder is a mental health condition which affects the normal eating pattern of the person. But the happy news is it is treatable. Thank you.